Bulging discs, herniated discs, degenerative discs. What causes all these problems? And what's the one predisposing factor that's never talked about? In this video, I'm going to answer those questions, and I'm going to give you tips on how to maintain a healthy spine throughout your lifetime. Hi, my name is Dr. Frank Altenrath, and I'm a chiropractor in Cresskill, New Jersey at Valley Optimal Spine. And in my office, we focus on corrective chiropractic techniques that help patients get through their acute and immediate pain, and then we restore spine and posture to a more ideal position so that they can function better, move better, and have a better quality of life. And if you're new to my channel, don't forget to hit that subscribe button below, click on that notification bell so you don't miss out on any fresh new content on strategies and tips on overcoming pain, alleviating stress, and improving overall quality of life. So let's talk about the anatomy of the spine first. So the spine has 24 bones in the spinal column, and in between the bones there's going to be 23 discs. The reason there's only 23 is because between the top two, C1 and C2 in the neck, there's no disc. So there's 23 discs in the spine and 24 bones. And the spine should have a nice curve when looking at it from the side. In the neck, a nice kyphotic curve, which is outward in the thoracic spine, and a nice lumbar lordosis, which is a curve going in the low back. From the front or the back, the spine should be nice and straight. Now, these spinal joints should bend to the side. They should be able to bend forward and back, bend to the side, and they should be able to rotate. So these are the movements that are key to a healthy spine. Now, when we talk about a motion segment in the spine, we're talking about one disc that's surrounded by two bones. So a bone, a disc, and a bone makes up one motion segment. So when we talk about the motion segments and the importance of movement in the spine, but that's the anatomy of the spine. Then we have the nerve roots that are coming out. Between each segment, you have the nerves that come out, and in the sacral area, you have the pelvis and the sacrum in the back, the tailbone. So let's talk specifically about the discs now. The discs of the spine perform three main functions. They serve as the shock absorber to the spine, so any axial load that we have on our body, the discs dissipate that load, so they perform a shock absorber function. They're also tough ligaments that hold the spine together. They keep everything so that it doesn't fall apart. They keep the spine in one piece. And the third thing they do is they're cartilaginous joints that allow for motion, so that the spine can motion, like I said before, rotation, lateral flexion, forward flexion, extension, things like that. So the discs serve those three functions. Now, when we have a healthy disc, the healthy disc should look very full and thick, and as you can see in this model here, this would be a healthy disc and the bones in between. Now, as we have injuries to the discs, and we'll talk about that later, when the discs start to dehydrate or dry up, what happens is you start to have the discs start to thin out. And we'll see on an x-ray someone that has thinning of the disc because the spaces between the two vertebrae will be really much more diminished. So we can see that here as an example. Here is a vertebra here, the disc over here, the bone up top and the bone below, and the disc in between. And as you can see, the disc in between is basically worn away, and these little jagged edges called bone spurs start to form in place where the discs are starting to wear away. And as you can see here, the jelly the disc is made up of a jelly-like material. It's like a crab meat consistency that starts to dry up, and in this case they're showing a bulge here, and we'll talk about how that happens. But this is something that on an x-ray you would see the space between the two bones gone, as opposed to this spine right here, where on an x-ray you would see the nice space in between, because you can't see on an x-ray the actual disc, but you see the space that the disc creates. And on this one you can see how that disc space is gone, and you would see two bones almost touching each other. So that's how we would tell on an x-ray. Of course, an MRI would tell you the actual, if there's a disc herniation, things like that. But on an x-ray we can see definitely the health of the discs or the spine itself. So let's talk about a disc herniation here. Okay, so here's a diagram looking at a spine from the top. They cut the spine in half, and you're looking down at the disc. So you're looking basically at this disc from the top. Okay, so we have the disc is consisting of a nucleus in the middle and the annulus fibrosus in the outer portion. Now, the outer portion, the blue, is called the annulus fibrosus, and that's made up of concentric sheets of collagen fibers called lamellae. The inside is the nucleus pulposus, like the jelly in the jelly donut. That's the middle portion, called the nucleus. And the nucleus is, it contains a loose network of fibers that are suspended in a mycoprotein type gel. And that's, like I said before, it's the consistency of like a crab meat, okay? So this would be a healthy disc within the annulus fibrosus, and there's no herniation, nothing like that. The annulus itself, the blue area, hydraulically seals in this nucleus, so it keeps it from escaping, and it also distributes the forces and the pressure, like I said before, of the axial loading of the spine. It's a shock absorber. Now, if we come over here, we can see a herniated disc. So here's the yellow, or the pink is the gel, and here we can see the gel is escaping, and it's touching on a nerve root. So wherever this nerve root is going to, if this nerve root goes down to the legs, down to the knee, down to the toes, it's going to cause pain, numbness, tingling in those areas. Now, the outer 1/3 of this blue area, which is the annulus, is where the pain fibers are. There are no pain fibers anywhere inside this area right here. So you may not even feel a disc bulge until it starts to touch on the outer 1/3 of the outer part of this blue until there's pain. So if this disc bulge were to be just about to here, you might feel pain in the mid-back. If the disc bulge starts to press here on the spinal cord, this is the spinal cord here, these are the nerve roots coming off. If it were to touch here, you might feel pain down both legs, or depending on where that nerve distribution is. If it's touching this nerve root here, you might find pain only on one side of the extremity. This could be the arm if it's in the neck. It could be the leg if it's in the low back. If it's touching on this side, it would be the other side that you feel pain on. But this would be a herniated disc. So why do these things herniate? Well, we talked about what causes these things. Well, we know that something like an injury, a sports injury, playing football, playing ice hockey, a car accident, trauma can cause a herniation. So that's one that we all know about. But let's talk about what's not talked about much. It's movement. Lack of movement will lead to a herniated disc. And let me explain why. So as I said before, the disc is the major distributor of forces in the spine, and it must stay hydrated. So in other words, at birth, the disc is about 80% water. And that water is important for a healthy disc to be able to distribute its axial load and serve as a shock absorber. And as I said, how does it get water? Well, the disc does not have its own natural blood supply. It needs movement for blood supply, which in turn brings nutrients in, brings waste products out. So movement brings the nutrients that create a healthy disc. Once the movement is not there, the discs start to basically die off, dry up, and then you have problems. So when we talk about movement, we talk about, if this is the disc in between, that the disc needs movement. Okay, every segment, not just one, this one, they all need to have movement for that disc to be healthy. Movement between these two for this disc to be healthy, and so on. If there's not movement, there's going to be a problem. So I have patients come to me all the time and they say, "Doc, I can still touch my toes. I know I have good movement in my disc." Well, let me show you how that is a fallacy, or could be a fallacy. If we take this stick, for example, and this represents the spine. If these were the vertebrae right here, okay, and the discs were in between. So if the discs are in between here and these are the vertebrae, the red represents areas that are not moving. The yellow is part of the spine that is moving. So as you can see here, if I bend this, you'll see movement between these balls here. So that if there was a disc in between there, it's getting nutrition. Down below, the same thing. You see, as I bend this, you see movement between the vertebrae. All the discs in between would get plenty of nutrition, be healthy. But here's an area that's stuck. This could be from an injury. Again, like I said, it could be from playing sports. It could be from poor posture. It could be from various reasons. But now, as you see, as I bend the spine, the yellow is bending, but as you can see, the red balls are not bending. So here's a person who can, let's say, touch their toes. They're going all the way down, but as you can see, the three red balls in the middle are not bending. So even though this person may be able to touch their toes and feel flexible, the discs in between here are not getting nutrition. They will eventually dry up, and at that point, when they dry up and there's tears in the annulus fibrosus, the outer ring, the jelly could leak out, you could have a herniated disc, you're more prone to injury. So that comes from an area that is not moving properly. Okay, so let's look at what that looks like, a disc without water. Let's see what that looks like on an MRI. Okay, so here we are, we're looking at an MRI. And remember what I said before, that the disc must be hydrated for it to be healthy and to be able to carry the axial loads of the spine. So the disc basically relies on water content to be effective. So this is an image of the lumbar spine in an MRI, and these are the bones, and these are the discs in between. Now this is a T2 image, meaning that water and fat will appear white. So if we look, we see here that this is the spinal fluid here. So this is the canal, spinal canal, and the spinal cord usually ends around L1. So these would be the nerve roots coming off the spinal cord. And here we can see the disc. These are the bones, disc, bone, disc, bone, disc. So we can see in this case, the discs are nice and white. It's a healthy disc, filled with fluid, because water appears white. Again, a white disc, very healthy, filled with fluid, filled with water. Down here, you can see that these discs they're dark. They're basically dehydrated, very unhealthy discs. And down here, we can see a herniated disc, degenerated disc, that bulged out, and it's very dark, it's dehydrated. So again, healthy discs would appear white, meaning they have a lot of high water content. That's what we want for a healthy spine. Down here, we've got issues. So that's what it looks like on an MRI. So let's recap the pathology of a herniated disc or a degenerative disc. So as I said before, with an injury, car accident, sports injury, or with lack of motion due to improper posture, old injuries as well, the discs start to dehydrate. They lose their water content and they start to dehydrate, making them become stiffer. As they become stiffer, they lose their ability to disperse the loads that are the axial loads that are put upon the spine, and so they don't do a good job at that, and that leads to micro motion instability. So the motion between the vertebra, between the discs and the two vertebrae, that motion becomes unstable. As that motion becomes unstable, that creates inflammatory proteins leaking out into the disc space, and those proteins, chemicals, will irritate the nerves, and that will cause nerve pain coming from the disc, or as I said before, or the disc can just bulge out or herniate and compress the nerve directly, which would cause pain wherever that nerve goes. So let's talk about that instability again. So as I said before, as that motion becomes unstable, what does the body do? Well, the body then lays down bones to prevent it from becoming unstable. We call that arthritis. So we see that all the time on an x-ray, where somebody comes in, they have a lot of arthritis in the spine, and people think it's a disease, but in reality, in this case, it is a normal process of the body with an intelligent response to instability. So as the discs dehydrate and they become unstable, what does the body do? The body says, well, we got two segments here that are unstable. So the body then will say, we got to stabilize that area. So the body will lay down more bone to fuse these two joints together. So this instability, which is a problem, the body will now put arthritis down over that area to stabilize it. That will be itself fusing itself together. In that case, the body is going to sacrifice mobility for stability. So it's going to sacrifice movement for stability, which is a more stable way the body needs the spine to be to prevent further injury. But we see that as arthritis, which of course for us means that we can't bend over as much, we can't twist, we can't turn, we just can't move as well because we have arthritis of the spine. But that arthritis of the spine is a natural response to a unhealthy spine, a spine that degenerated, and now the body is doing something to prevent further problems by creating these bone spurs and these growths to stabilize the spine. So how can we maintain a healthy spine throughout our lifetime? It's a key question, and there is an answer. So as you can see, we talked about motion, okay, being a key ingredient or lack of motion in having a spine that degenerates. So when you go to a chiropractor, especially a corrective care chiropractor, what we do in our office is we can take motion x-rays, motion study x-rays. So we can have the person standing in a neutral position, then take a picture of them in flexion and a picture of them in extension. And we can compare the views, and we could see, number one, when they move their head back or forward in comparison to a neutral spine? Are they getting motion? Is every segment of that spine moving? Or are there 3 or 4 areas that are not moving? They're moving as one as you bend forward. There's no motion, let's say, in 3 or 4 of these segments. Okay? That's called a motion study x-ray. We can also determine if there's any instabilities because we can measure the movement between vertebra to see is there any segments that are unstable that need to be addressed. So therefore, we first find the areas that are not moving, and when we find those areas that are not moving, we know that that's going to jeopardize the health of the discs in between those segments. So at that point, after we did a proper analysis, diagnostic tests, proper x-rays, we will then do a numerous different types of treatments, but one being specific chiropractic adjustments to those areas that are not moving. So if we know that there's no movement in C4, C5 inflection, well, we'll do a specific adjustment to create the movement in the areas that are not moving. We don't want to touch the areas that are moving because we can create hypermobility, meaning too much motion. So it's key to find out what areas are not moving and put the motion into there so that that disc in between can stay well hydrated and will never have to degenerate like what we talked about and saw in the pictures. So we will then find areas throughout the spine, the neck, the mid-back, the low back. We will look for motion, and we will also look for the overall global alignment. Is there a curve in the neck? Is there the proper curve in the mid-back or the low back? Is there too much curve, too little curve? Is there no motion whatsoever in the entire lumbar spine or the cervical spine? So we find those areas, we address them with specific corrective techniques that we use in our office. That can include specific traction techniques, specific adjusting techniques to get the spine moving and restoring the health to those discs so that you never have to go through that degenerative process that people think is inevitable as we age, but it does not have to be. Thanks for watching this video, and if you have any questions on what we went over today, leave them in the comments below and I'll try to get back to you as soon as I can. And look forward to our next videos. We're going to try to address all the topics that seem to come up in our office that patients ask us about. So again, thanks for watching. We'll see you in our next video. Valley Optimal Spine is located on 80 Broadway, Suite 1A in Cresskill, New Jersey. Our telephone number is 201-569-1212.